Hello, everyone. My name is Rishi Manchanda. I'm CEO at Health Begins, and thank you so much for joining us, at everybody here at Health Begins and our presenters for this webinar entitled Redlining and Health Equity, How Health Systems Can Help Dismantle Structural Racism. I really want to give a welcome to all of you right now. And before we start, we would like you to know that this webinar is being recorded. And we will be sending this recording out to all registrants after the webinar, and we have a record number of registrants for today, not surprisingly. Please note that all participant lines are on mute. If you have a question for us, you can enter it at any time in the question box that appears on the GoToWebinar doc. We've reserved time at the end of the webinar to answer all questions that come in through the question box. This presentation will last for 1 hour, and with that, I'm going to go ahead and just formally launch us today. My name is Rishi Manchanda, as I said, and I'm joined today by Angela Glover Blackwell, founder and resident at PolicyLink, Josie Williams, Director of Community Engagement at the Greensboro Housing Coalition, and Sadhana Devaraja, Managing Director here at Health Begins as well. And I can't be more thrilled to welcome them in a few moments to the stage. As a reminder, as I mentioned, please do submit your questions and any comments you have during the Q&A pane. We'll answer your questions at the end. Please do, during today's webinar and certainly afterwards, stay engaged with us. You can tweet at us using the handles here, with handles for everybody who's presenting today. As I mentioned, we are going to be having a wonderful conversation today with the folks that you're going to hear from soon, including Josie Williams, Angela Glover Blackwell, and Sadhana. With their help, we'll be able to make sure that each of us will be able to end this session in order to do 3 things. We'll end with the confidence to describe the history of redlining in America. We'll be able to identify the impact of redlining on current efforts to improve social determinants of health and equity. And we'll detail at least 3 ways health systems and community partners can help dismantle and prevent redlining. So let me set the stage really quickly by translating those objectives into plain speak. The questions really that we're going to be thinking about, and we encourage all of you to keep in the back of your mind as you're listening to today's wonderful presentations, are these. First, what is redlining? Second, how should redlining inform the way we think about and address social determinants of health and equity? How might proposed changes to the Community Reinvestment Act and other federal and state efforts impact redlining, and also the potential impact of current upstream efforts that many health systems and community partners are working on? And finally, how can leaders in health systems, the communities, including place-based collaboratives, help to undo redlining? So with those questions in mind, many of you are familiar with us at Health Begins. We're proud to be a convener for today's conversation, but we're also busy working alongside many of you across the country right now to help improve care and the social drivers of health and equity in a variety of ways. And before I go on and telling you more about us, let's more importantly hear from you. And let's launch our first poll to get a sense of who's on the line. What best describes your organization or association? So I believe we can launch the poll now. And with the poll up, you're answering questions like whether you're a hospital, clinic, or healthcare delivery system, health insurance plan, community-based organization, public health agency, research, education. Let's leave the poll open for about 5 more seconds. Got about 77% of you voted. Let the late voters chime in, and great. Let's go ahead and close the poll and see how we did. So the poll results indicate that 1/4 of you are from health systems, which is wonderful. About 20% are from CBOs or social service agencies, 23%, another 1/4 or so from public health, and another 1/4 from research or education, with a small minority from health insurance companies. So a really wonderfully diverse group. And of course, if your specific industry or sector is not mentioned there, please go ahead and just share that in the comment box, including the name of your organization. We'd welcome a chance to get to know who's on the line. But clearly we have a diverse group on the phone today on the webinar. And with that in mind, let's go ahead and understand, I guess, how all of us, at least at Health Begins, describe the work that all of us are engaged in, regardless of which sector you're in. Our theory of change in a nutshell is that to improve health requires coordinated action, and that coordinated action to drive health improvement occurs at 3 levels: population health, community health, societal health. And we won't spend time today going into much detail, just know that the way that population health has been defined primarily by those in healthcare really means improving outcomes for defined member populations or defined patient populations. This is how population health management and others engaged in that effort traditionally describe their work in population health. There's community health, which is really improving outcomes not for defined members or patients or individuals, but for defined geographic areas. And then there's societal health, which is to improve both public health as well as structural determinants of health equity, again, at the societal level through a variety of means. Those are three different levels of health improvement. And what we mean by moving upstream is to move upstream by continuously improving social drivers of health and equity at all levels. Those levels are three: social needs for individuals, social determinants for communities, and structural determinants for society. And so when we then come back to our thesis, really, our thesis is that moving upstream enhances each level of health improvement effort. When it comes to population health, it means addressing social needs. When it is community health for defined geographies, it means addressing social determinants of health, which is the more precise way to use the term, as our public health friends have often admonished us and advised us. And then, of course, to improve societal health, it means addressing structural determinants of health and not just social needs for individuals. So to move upstream means the following. And with that in mind, let's start today's conversation on redlining and why it matters given our thesis and why it matters so much to the experts you're going to hear from in a moment. There's a lot here, and I just want to give you the highlights. Many of this is both familiar to you from a perhaps academic or professional sense, and for many of you from a very personal sense. The brief history here, of course, is that the Great Migration it has to be understood if we think about what modern redlining looks like. The Great Migration represented the large internal movement of any group in American history, of African Americans specifically. There were two waves from 1910 to 1940. Over 1.6 million African Americans left the South. And then the second wave from the 1940s until the 70s, another 3.5 million people migrated. And the reasons, I think, are manyfold, but the high-level summary is that the basic drivers were to escape persecution in the Jim Crow South and to search out economic opportunity afforded by labor shortages in the industrial North. And that both waves, of course, were triggered, these labor shortages and the opportunities economically that were available in the industrial North and other parts of the country were fueled by first World War I, and then just prior to the second wave, of course, World War II. There's a deep, rich history here. A wonderful book called The Warmth of Other Suns with a citation at the bottom is something we highly recommend to learn more about the Great Migration. But what's important to know is that the Great Migration is the backdrop against which redlining, the modern version, started more formally. In 1933, faced with a housing shortage, in part because of some of the Great Migration issues, the federal government began a program explicitly designed to increase and segregate America's housing stock. And this started with the creation of maps that were then color-coded and then adopted by a variety of federal agencies as well as those in the private sector. Those color codes for those maps, as you can see here, looking at a map just of one locality, in this case in Denver, were designed to indicate where it was safe, quote unquote, for, in this case, loan providers to insure mortgages. And what is notable, of course, is that anywhere where African Americans lived or was nearby to where African Americans lived was colored red. And this was meant to indicate to appraisers that these neighborhoods were, quote, too risky to insure mortgages. So redlining really represents, as you can see in the top right here, the systematic denial of various services by federal government agencies, local governments, as well as the private sector. And that includes those of us in healthcare. And I'll mention that in a moment. The systematic denial to residents of specific, most notably Black neighborhoods or communities, either directly or through selective raising of prices. Again, this is something that some of you are perhaps aware of. Many of you may be peripherally aware of redlining, but now you know. And the other important thing to know is that it's not just a history lesson, that redlining persists. It's a modern set of phenomenon. And while the best known examples of redlining have involved denial of financial services like banking, mortgages, et cetera, or insurance, redlining persists in other areas to this day. Healthcare redlining or medical redlining manifests, especially as you can see here with the citation in terms of hospital closures. Supermarket redlining is an issue that we see increasingly these days. And there's also even more recently, especially in ways that the healthcare community is becoming more aware of right now, there are forms of digital redlining in which use of artificial intelligence, algorithms, et cetera, may be in fact actually perpetuating and upgrading institutional racism rather than dismantling. So redlining is not just something that started in the 1930s and is linked to the Great Migration, but is an issue that pervades everything that we do these days. In fact, this map on the bottom right is not something from the 1930s or 1940s. It's from 2015, created by a realtor in Cleveland who created his own grading system to identify neighborhoods where his clients could look. And if you look at the areas he shaded red, clearly without any kind of sense of history or irony here, this realtor mapped areas in red that directly overlap with the same redlined areas that the federal government created in the 1930s and 40s. So with that in place right now, I wanted to set the stage, and more importantly, then move off the stage to give the floor to, I'm gonna skip past this, and give the floor to you guys before we turn it over to our first presenter and ask you guys this. Now that you have a better sense of redlining as it's defined, what formal experience does your organization have in understanding or addressing redlining? Let's launch the second poll now so you can answer this question. Either you have limited, as an organization, limited or no experience, some experience in understanding or addressing redlining as an organization, significant experience in understanding or addressing redlining, or significant experience along with a leadership role that you help lead efforts to understand or address redlining. Let's leave the poll open for a moment. About 2/3 have voted, thank you. Great, let's go ahead and close the poll now that we have about 70% voted. And you'll see that at this point, about 41% candidly kind of revealed that when it comes to formal experience as an organization, that about 40% have limited to no experience. Another 41% have some experience. 15% have significant experience in understanding or addressing redlining, and just 3% have experience that's significant, but also play a leadership role in helping to drive understanding of this issue. This is really helpful. It is quite eye-opening for all of us to think about where we stand institutionally as representatives in our institutions about this issue of redlining. And with that in mind here, let's go back to the presentation and hand this over to our first incredible presenter. Josie Williams is the Director of Community Engagement at Greensboro Housing Coalition. Josie, the floor is yours. I'll go ahead and advance your slides if you just prompt me.
Okay, thank you. You can move to the intro title slide. Thank you, and thank you everyone for joining. I hope that to share with you today a local perspective on the impact of redlining and how our collaborative came together to address issues such as redlining and how those issues have impacted our local neighborhoods. And so before we advance to the next slide, just a little bit of what you're going to see in this first illustration, because it is a brief video. It is actually where I grew up. It is a red line community called Old Ashboro. And what I want you to first notice in the beginning of the video, because it will move quickly for time, I shortened it, but it's just taking a ride along the main strip of the area that I grew up. And so I want you to notice as the video progresses, the infrastructure, and notice the street lights, notice the sidewalks. What do you see around the area? Do you see stores, or do you just see grocery stores, or just kind of notice the characteristics of the neighborhood? And so Richie, if you could go ahead and hit play. And this is Martin Luther King Main Strip that's going through the area I grew up. And just again, as you ride through this and just looking at this visual, you'll notice just kind of the infrastructure is just really houses on both sides. There is one school up there, and then there's a shift here. You see these sidewalks and crosswalks are changing. Now this is still in the area, but there begins to be a shift. Notice even the street lights are beginning to change, the crosswalks, and the road looks a little wider. And then we are at downtown. So this is the horizon of downtown. This is literally less than a mile. And so at the crescent of that neighborhood, which is under the poverty line, is these multi-million-dollar homes and a multitude of businesses. And so why I illustrated that, you can literally see the divide that quickly. That was just really less than a mile up the road. And so I wanted to illustrate that what we have at the top and how it begins to, you can significantly see the divide. And the reason I wanted to point it out is because a driving cause of segregation and neighborhood disinvestment for years is a result of a red line that has exclusively and systematically kept certain groups out of ways that they could build up economically. And then so then less than a block away, I'm turned around and I'm traveling back down the road. And I'm about to turn now on the street where I grew up, less than a block away. So this is less than a block away from that development that you just saw. And so what we have here is just the, and that ended kind of quickly, I'm not sure why, but what we have is just a lot of substandard housing, a lot of boarded up housing. And I'm 46 years old. So what you're seeing, some of this lack of development has been like that since I was a little girl. And so when we're asking what the root cause of redlining is and what that looks like in reality, this is it. And my mother still lives right around the corner from these houses. There's houses boarded up still on her street. And so when we're looking at root causes, you have to ask, what is still causing this machine to be at work? Because obviously it doesn't need an operator still, but how our systems are aligned, you can clearly see the lack of investment. And literally, you can walk around the block and you're around from that. And so you can move to the next slide. And so that's just a picture of what that neighborhood looks like as far as where I grew up. And then segueing a little bit more deeper into the work that I do with Collaborative Cottage Grove. So Cottage Grove is also in Greensboro. The characteristics are similar, but the difference in what's happening in Cottage Grove is because of the nature of our collaborative work. We are joined with our health system partner, Cone Health, our Guilford County Department of Health, a host of other nonprofits that focus on upstream initiatives to address the issues like redlining, to dismantle certain policies and systems that have contributed to this disinvestment and this divide. And so for Cottage Grove, what we see is in this particular community, we have an area that intersects, that is intersecting with substandard housing, intersecting with high asthma rates because of the environmental conditions. And Dr. Rishi, if you can move to the next slide. This particular red line map is a red line map of the city of Greensboro as a whole. The map beside it is a map where we work with the health system partner to look at data regarding respiratory related issues. And if you look at the legend, this red coincides with the hazardous red that's on the redlining map. It illustrates what we just saw in the video, this divide, like this, there's a definite intersection of health and environmental challenges directly related to redlined areas. This also coincides with some more data that we pulled from our county health department, where the life expectancy by birth in certain census tracts, which these are the low-income census tracts, to be honest, all associate with this same intersection. If also within Cottage Grove, what we have because of that type of red line and that exclusive cutoff is what I call it, we have residents living still in the residue of that impact. So we have residents living in a community with a park that is sitting on top of a landfill, and we are working with the state to mitigate those issues. This asthma map that you see, although this is Greensboro as a whole, when we looked at a particular apartment complex, and you can fast forward to the next slide. When we looked at a particular apartment complex, in one complex, I had 177 units. The average for pediatric asthma or asthma complications that people were going to an ER was higher than the county as a whole. And so our collaborative, when we joined forces together, we started off with 4 partners that included my agency, the Greensboro Housing Coalition, New Hope Community Development Group, which is workforce development, and then also Cottage Grove Initiative and Mustard Seed Health, both nonprofits, one being a clinic. We wanted to leverage the expertise because it takes a collaborative effort in cross sectors to address these systems and dismantle what you just saw. And so because of that, what you see on this slide is the community impact from resulting from those changes. And as I mentioned, we're in the process of working with state and Parks and Rec to mitigate that. But the thing about our partnership, everything that we do, we prioritize the community's voice in the decision making. So the strategies that's laid out here, we actually developed that with residents leading community action teams. So this is not something we came up with. This is something coming out of the hearts and minds of residents who are living in the residue of this systematic exclusionary practice. And so if you could go to the next slide. Because of the impact and of course that we're describing here, the need for our health system to be on board in a very active way was absolutely necessary. And it was very interesting that when we started, their approach to advocacy and this work has evolved in such a positive way since then. I know there are some questions about how health systems can be involved in advocating for something like this and how they can be a part of the change that we were mentioning on the previous slide, and the way they are helping us through that. For the first time in the last 2 years, our Healthy Communities Director, who you can see up in the top left corner, she is actually teaching her pediatric residents about redlining. And so what we did, a part of our collaboration, I got to thinking like, what if we can start changing what pediatric residents look like as far as their community engagement? What if we could change that process? Not change it, but enhance it. I know residents have to go through a community engaged process, but I want them in the community to see the reality. I want them to have a day in the life of a Cottage Grove resident or a neighborhood like where I just grew up. And so those conversations open up different ways that our health system partner could educate. Kathy Colville is very knowledgeable on the subject, but even she learned a lot more when she sat in rooms with community members to hear their reality and actually came to the community to see it live and in color. So she spoke to me one day and talked about their institutional influence. It's not always just about capital, but their influence led to us getting that apartment complex under rehab. And although the Cone system didn't put a dime in it, they're investing in our work because we are a Build Health awardee, and so they do give us matching funds to help with that support for the work that we do. But the influence of the health system, for her to speak in front of Minimum Housing Commission, who regulates housing policies and holds people accountable, the bad actors, that had never been done in the history of Greensboro. And what she did is change the hearts and minds of City Council, Minimum Housing Commission, and she began to facilitate discussion inside a Cone that is causing a cultural change in that system. And so these are pictures where, for the first time, the one on the top right, she brought all the leaders in the health system together to talk about these issues. That blew my mind. And for them to really be educated in a way that they hadn't done before, it led to some dramatic influence where now these individuals are now sitting in affordable housing meetings trying to figure out how they can support to dismantle issues like redlining. And so with that, Angela Glover is going to go a little bit deeper and talk about this more on a national level.
Hi, thank you, Josie. The first thing that I want to do is to actually show what it is that I want to cover in my brief time. I want to talk about the fact, and Josie has just illustrated it perfectly, that where you live is a proxy for opportunity in this nation. Then I want to emphasize that the legacy of redlining continues to this day. And last, that imaginative, transformative public policy will be required to overcome this legacy and to create lasting impact. Let me just speak a moment about how where you live is a proxy for opportunity. We actually know this, but it is so stark when you have to face the reality that housing has become the thing that is impacting our lives in so many ways. But if you're of color and you are low income, Where you live actually will determine whether or not you have access to good schools, whether you have access to jobs in your neighborhood or a natural job network, which is how people get jobs. They know somebody who works someplace. Whether you have access to reliable transportation that can connect you to opportunity throughout the region, it determines whether or not you are likely to have economic mobility. And there have been big studies using big data to be able to show this on a national scale as well as within a region. Where you live determines all of those factors that actually let us have access to the social and economic mobility that is so important for health. I grew up in St. Louis, Missouri, and even though I live right in Oakland, California now, it's true all across the country. In St. Louis, Missouri, where I live, right where I lived, right now, there's a zip code 63106 that will show that in a distressed neighborhood in northern St. Louis, 96% of the residents are Black, and over 50% of them live below the poverty level. That in a similar area, not far away, 63105, only 20 minutes away, you will find that the life expectancy is 16 years more. The maps that you see here actually show what's going on right now in the Bay Area, which is where I live now. On the left, you see maps that show areas that were historically redlined, and they are red. On the right, what you see is asthma-related emergency room visits per 10,000 residents. And you will see, looking at the larger map, which is San Francisco, that runs, you see how it runs, and the smaller map, which I think is Oakland, that you see where the darker areas are, that is where the emergency room visits are, showing, and this is no coincidence, that the very areas that were historically redlined, those communities that are placed at a disadvantage, continue to be predictors today. We have to do something about this because the relationships between these things and well-being are stark. And what we know is that the people of color who live in these areas and continue to suffer from the legacy of redlining right into today will determine the fate of the nation. That Next slide, please. That what we know is that we're rapidly becoming a nation in which the majority will be people of color by 2045. And looking at the gray, you see the reduction in the white population. If you look at the colorful parts of the columns, you'll see this is the growth in people of color. Unfortunately, the people of color are the ones who are experiencing some of the worst health outcomes, experiencing the impact of a wealth gap between people who are white and people who are not in this country, are experiencing underemployment and unemployment, which makes for their spending and their ability to be able to attain the lifestyles that they need to be healthy and to be fully contributing. All of the risk factors that we're concerned about are concentrated in the very populations that will determine the future of the nation. I often say, if this nation does not begin to invest in the very people who've been left behind, the future for the nation is not bright. What we know is that it will, next slide please, is that it will take policy to move us out of this situation. We became a nation with these vast disparities that can be associated with race and ethnicity through public policy decisions. You saw in the beginning when Rishi made his presentation that historically it was public policy in cooperation with financial institutions that pushed low-income communities of color into neighborhoods that then suffered from extreme disinvestment and prevented the ability to be able to build wealth through equity in the home, and prevented people who were of color and low income, particularly Black, but not exclusively, from having access to communities of opportunity. We need a public policy frame that does three things. It creates more affordable housing in existing communities of opportunity. It actually is able to maintain and stabilize affordable housing in communities that are becoming communities of opportunity. Things have gotten more complex over the years, and we all know about the impact of gentrification and displacement. Many people who have lived in communities that were suffering from disinvestment now are living in those same communities and having a difficult time staying there because rents are driving them out. So we need to stabilize affordability in communities that are emerging as communities of opportunity. And ultimately, we need to make sure that every community is a community of opportunity. There's several things that we're doing at PolicyLink that actually highlight this. At the bottom of your screen, what you see is the All in Cities Anti-Displacement Policy Network. And this is an effort at PolicyLink to be able to pull together across the country people who are leading in terms of being advocates for full inclusion and affordable housing and stable housing with city officials and others to be able to improve the outcomes for low-income people of color by focusing on housing. We have pulled together 10 communities with 64 leaders, and what we are doing is getting them to share their strategies and develop new strategies that create affordable housing, that build business stability, that create community ownership, that really propose equitable development and protect tenants. On the right side of your screen, where you see why renters rise, when renters rise, cities thrive, one of the things that is important, and we're doing this at PolicyLink with many other partners, is that we're becoming a renter nation. But as we're becoming a renter nation, we have become a place in which the majority, over 50% of people who are renting are paying more than 30% of their income on their rents. That makes them rent burden. Through this study, and we looked at many communities across the country, we found that on average, there would be $124 billion extra dollars in communities if we got rid of rent burden. That is, that people didn't pay more than 30% for rent. That would be an average of $6,200 per rent burden household. So not only would it put more money in the pockets of people who are renters, which allows them to improve their lifestyle, but it puts more money in community. At the top in the right, what we really are looking at is how to be able to think creatively about health and housing together. That we know that housing impacts health, and looking at how to get health professionals and people who are concerned about health to know that by focusing on health issues, by looking at ways to be able to promote more home ownership, looking at ways to be able to improve the quality of life for renters, make sure they have more rights, that they can't be evicted willy-nilly, that we actually have to have some rent protections. All of those things are important for people who are concerned about health outcomes, as well as making sure that we focus on the obvious things like lead and other things in the home. And then we are also a part of an effort in San Francisco Bay Area to be able to pull together the extraordinary resources of San Francisco. And there is something called the Partnership for the Bay Area's Future, in which there is a commitment from multiple foundations, individual donors, and community organizations to be able to protect 175,000 households over the next 5 years by preserving affordability and producing 8,000 homes going forward. As part of that effort, PolicyLink is actually hosting the Challenge Grant Fellows who are working in jurisdictions throughout the Bay Area to help local jurisdictions in the Bay Area implement strategies that make a difference going forward. There's lots going on. One of the things that we all need to be thinking about is some of the proposals to change the Community Reinvestment Act, which was proposed, the proposed changes threaten something that has been around for more than 30 years, to encourage banks to reverse the impact of redlining by investing in home ownership and building small businesses in historically disinvested communities. There are proposed changes that have come out from the current administration, and there is a real fear that these changes will divert funds from affordable housing and small businesses and economic development in low-income communities and allow for that same activity that used to have to go to low-income communities to go to things like sports stadiums and bridges and infrastructure projects and small businesses on the larger end rather than small businesses on the smaller end. I mention all of that because that is the wrong way to address the issues that we are concerned about. What we have shown again and again, next slide please, is that when we are trying to address issues of inclusion, while we are sometimes drawn to what we might think of as creaming or going to the easiest thing to do or going first to those people who already have shown that they are making progress, is that we just put off having to address the issue fundamentally. By addressing the impacts of structural racism, designing strategies that focus on those who historically have been most excluded, we create opportunities for all. And I call that the curb cut effect. You can find this article in the screen below. It was published in the Stanford Social Innovation Review in 2017. But it makes the point that if you really want to solve an issue, you have to go to the most vulnerable. It's like those curb cuts in the street that are there because of the advocacy of people with disabilities in wheelchairs, but we all benefit from the curb cut. Similarly, if the Community Reinvestment Act stays focused on the most vulnerable, if when we're doing renter protection, we focus on those renters who are most at risk of eviction, who are most rent burdened, if we focus on those families that are struggling to purchase homes, but will not be able to do so without some assistance, if we solve problems from that perspective, we solve them for everyone. And now I'd like to turn to Sadhana Thabaraja, who will continue our conversation.
Thank you so much, Angela. It is truly an honor to follow you on this webinar. My name is Sadhana Thabaraja, and I'm Managing Director at Health Begins and a lawyer by training. I'm hoping I can tell you a little bit about myself before we start off what I hope is an ongoing conversation about how we can each, both in our own work and how we can come together to undo redlining. And I know questions have been coming in. Please continue to submit questions, and we're going to reserve time at the end of this when I conclude to get to those questions. So just a prompt to keep putting those into your question doc on GoToWebinar. About myself, I came to related work on redlining nearly 15 years ago when I'd been working in public health for a few years and was considering getting a law degree. And so I went to my local ACLU, the ACLU of Maryland at the time, to see if my inclination about knowing more about the laws that shape our communities would help me better address the root cause of what was making my neighbors sick. So at the time, that office was working on post-trial proceedings to a landmark civil rights case brought by the ACLU of Maryland and the NAACP LDF fund called Thompson versus HUD. It was a segregation in public housing case against HUD for policies that, working similarly right in line with redlining, entrenched segregation and furthered that opportunity isolation that Angela spoke about within Baltimore. So the case had been filed in 1995. An initial judgment was issued in 2005. And when I went to volunteer on post-trial remedies, it was 2008. And so November 2012 is when the historic settlement came through from the courts on that. And I mention all this because what that working, just as a volunteer doing doc review on that lawsuit and the resulting settlement, what that drove for me is what's been mentioned here already, that these segregationist policies that restrict opportunity for Black and Brown people are not only a historical occurrence, right? This is not only happening or being resolved in the past tense. This is happening now, and it's our responsibility to act on it now. And that, too, the response to these structural violations needs to not only call out the destructive practices, also to halt those practices, and also to make conscious, deliberate efforts to remedy them. So I'm honored to speak about undoing redlining in that regard, and I'll be bringing in themes from our presenters as well as borrowing from some of the features of that housing settlement to kick off what I hope will be an ongoing discussion that we're inviting all of you to among our Health Begins community on how we can work on undoing redlining through the work that we do. So if you go to the next slide. So a lot of the work that we do with clients and partners is to address the social drivers of health. And what today's presentations have really made clear is that understanding redlining affects the way that we approach these clinical community partnerships as we're addressing the social drivers of health. It's going to affect how we show up to partnerships, really to Josie's point, how we act within partnerships, and how we sustain these partnerships and make sure that we can be in this work for the long haul. So to that end, if you go to the next slide, there are kind of 3 levels of action that we've put together, that we've started brainstorming on to take action to undo redlining at the individual level, at the institutional level, and at the state and federal level. And so if we go to the individual level first, we recommend that folks educate yourself. So, be that internal champion and catalyst that Josie spoke about. Educate yourself, and there are means to do this, right? To do your own homework. It means to look up the maps for your area, know how your affected communities look physically. That trip that Josie took is not one that you can't take. Don't be a tourist, but be intentional in knowing how these red lines are impacting the communities that you're serving. Learn the history. You can read The Color of Law. That was a book that Angela had mentioned as we were prepping for this webinar. It's a book that I think we've all read at Health Begins, and can be a good primer on understanding what you should know as you enter these conversations. In terms of looking up maps for your area, the one that we have on screen here is, I think, the Mapping Inequality map through the University of Richmond. You can look at mapping segregation in DC. There are a variety of tools here that can help you understand what this looks like in your neighborhood or in your communities. And remember that educating yourself doesn't make you an expert, and it doesn't mean that you have to be the expert. This helps you show up in the right way to conversations, particularly around partnerships and community engagement. And I think the lesson we heard really loud and clear from Josie is, to make sure that you make a commitment to prioritize the resident voice as you're doing this. And that doesn't require that's even on the individual level, that if you personally make that commitment through all of your work, that's taking it a step in the right direction. Next slide. We'll talk about some of the institutional commitments that can be made. So as we think about being that internal champion and catalyst that Josie spoke about, there are a variety of mechanisms that are out there and possible for you to think about on the institutional level. Things like racial equity impact assessments. These are assessments that are maybe similar to environmental impact studies or financial assessments that folks will have to create when they're thinking about taking an action or making a decision. And things like racial equity impact assessments are available. There's toolkits available through Race Forward, as an example, that lay out steps of what's included, how to identify engaged stakeholders impacted by the proposed action, how to consider adverse impacts, and how to address those. And that's one step as an institution that you can make a commitment to doing those for projects and actions. You can contract for equity. This could be from provisions within contracts to how the contracting process is carried out itself, so how your organization sources and bids for contracts. These can be vehicles to making your commitment to prioritizing the community voice, for example. You can make that a standard across your institution and make that something that you'll do for all of your contracts. You can level the economic playing field by sourcing staff or organizations from historically redlined communities for employment or procurement opportunities. And so here the guide from the Government Alliance on Race and Equity might be helpful in helping you contract for equity. And there's investing for racial equity. From community benefits departments to management of institutional capital investments, hospitals and health systems are major institutional investors. And so as health systems are developing their investment portfolios for financial and social returns, we believe that they have an opportunity and also a responsibility to make sure that their investments help undo redlining. And so the work of the Mission Investor Exchange can be helpful here. And then going to federal and state actions that can be taken. So Angela brought up the Community Reinvestment Act. That one is, as she mentioned, one of the most important laws that we've had to hold banks accountable to addressing banking and lending inequalities, and it could use reform in terms of being better to manage the modern realities of lending practices and how they work. However, the reforms that have been brought up by this administration, rather than further the original intent of undoing redlining, it's really taking harm to that original movement. So as we're talking about preventing or undoing redlining, this is actually working to reinstate some of those harmful practices. So we're not experts here at Health Begins on that. Angela had recommended some organizations like the National Community Development Association, National Fair Housing Alliance, that are experts in this field, that are organizing in these efforts, and could be useful resources. And we bring this one up in particular because there are going to be opportunities to submit comments for regulation. For the CRA, it's open right now, and it'll be open through April 8th. So this is an opportunity for you to flex those muscles and start looking up these organizing entities and provide comments to the rules before they close. I think thinking creatively about solutions and calling for solutions is important. We're in an election cycle right now. There have been policy proposals put out regarding redlining. Read those, be critical about them, give your response to them, and ensure that this is an issue that's important as conversations are happening politically. And the final kind of theme that I would bring is look at related state and local campaigns. So Josie mentioned and made clear that the relationship between red lines and environmental challenges is something that we know about, right? And so look at environmental justice groups like the Environmental Justice Health Alliance has a map of campaigns across the country, and see how you can plug in to those types of opportunities locally at the state level. And so I would conclude on that. Those are, some of the tips that we've come to in our work. We recommend that if you advance the slide, Rishi. And so what I would recommend is that you take those actions, and that you stay engaged with us as we move forward in this work and as we continue evolving this conversation. And so I'll turn it over to you, Rishi, to lead off the Q&A. Thank you.
Sadhana, thank you so much. Angela, thank you, and Josie, thank you as well. I think as we're seeing from some of the questions coming in, each of your presentations is resonating deeply, and certainly that goes for me. So with gratitude, and frankly with a bit of excitement and deep interest right now, I'm curious about what each of our experts who presented today have to say about some of the kind of key questions that we posed at the top of today. And you've answered many of these, but I think this might be an opportunity to have a discussion, what we call the Wireside Chat. So let me put this first question out there, which is based on your experience and much of what you've already presented today. I'm wondering, what are some of the most helpful ways to begin or accelerate the process to undo redlining? And Angela, maybe I'll ask you to start us off with a brief comment, and then we'll go round robin to Josie and Sadhana, and before we open it up to other questions.
I think the most important thing that we need to do as a nation, not to mention as people who are concerned about health and well-being, is to really understand and own the legacy upon which the nation is built. It is a hard thing for a lot of people in this country to swallow, because it is so ugly that the nation was built on stolen land, genocide, and human bondage. Once we understand that, it allows us to know that we have a big job in front of us to be able to, one, change the narrative about who it is we want to be, and then change the policies and the structures about how we get there. That we have left as a nation people behind because we have not valued them as people or their contributions as a nation. These have to be structural changes, and all of us need to own that the most important work we have to do, whatever our entry point is, to create more opportunities for people to realize their full potential. Housing has a lot to do with that. The quality of life and community has everything to do with that. But the narrative that we tell ourselves about who we are as a nation and what we want for everyone is one of the most important things.
Mm. Yeah, we can't change the structures without understanding our story.
That's right.
It's something that resonates deeply. Josie, I'm curious how you think about most helpful ways, especially drawing on some of the really rich experience that you shared at the top of the presentation today.
I think what has helped in our work, and I would recommend this as far as the health system perspective particularly, is I remember engaging for the first time when we started this different process with their community, with their pediatric residents. And I remember a resident asking me, very concerned about the red tape that comes along with the health system, right? And so they were cautious to advocate and what that would look like and not to get in trouble in the system. And so I told them, you could advocate in several ways on an individual level because you're on social media, right? And I'm not saying that your private account should be used in such a way it's all about a particular thing one way or another, but there are other ways that your voice can carry. And and I told them, I remember that Healthy Communities Director set a precedent. So it's obvious that you can go before council when needed and when necessary and be open to that. I don't think that, and I caution them to not always use the reasoning, oh, well, it's the red tape and we don't want to get in trouble, because we're dealing with people's lives here. So you see the reality of what we're dealing with. So please do not tell me you're cautious as to go speak out about what you're seeing and you're a resident. And so I think there's ways, when that happened for us, it accelerated and created a policy change, because with that data that was presented by that health system, and then with the qualitative data that we presented with stories, and then having residents in the room that was with us speaking in front of council, I have never seen the reaction of people on council like this. People were in tears, people were angry, and then that landlord didn't have a chance. And so for the first time in history, they slapped down this order of repair, meaning that they either fix it or the city would take it over and put a lien on it. That's just a short version. And so that accelerated process, and that was only because she made a choice to come with us to present data, but we needed those numbers to illustrate this is what's happening because of this environment of this home, and look at what this means to so many people who are living in that environment. So I think that advocating in that way is very helpful.
Josie, thank you for that. Sadhana, you want to take a quick pass, and then I'm going to bring in some questions from the audience.
Yeah, that's great. And I think my pass is really reflecting both what Angela and Josie just said, which is, I think, some 3 C's, and I think I get this from you, Rishi, to put them in threes here, but to, think about your community. So that includes knowing that story, coming to a reckoning with that story, and listening to them. So community would be the first C. Be courageous. So push back when you hear that things can't be done or are hard to do, and to be creative. I think to Josie's point that, there are other ways to look at the solutions and to get there. So that's kind of how I would synthesize what I'm hearing from Angela and Josie and would advocate for.
That is great. Let me bring in, we're not going to go to the questions on the bullet points, so just as a prerogative as the Wireside chat moderator here, and I'm going to bring up 2 really intriguing and frankly somewhat provocative questions that have come through, and wonderful questions that have come through. But let me bring up 2, one from Lydia Lowe and another from Janae Oliver, and kind of reflect them to you guys. The first question is this: how do we ensure that as there's investment in communities that have been historically redlined, that we're not somehow aiding and abetting in gentrification? As Janae put it, there seems to be a symbiotic relationship between redlining and then subsequent gentrification. And more specifically, as she says, how do anchor institutions like hospitals safeguard against this? That's one. Let me give you the other question just so you can, while you're pondering that, a really great question, and ask it from Lydia's perspective, which is it's a question about displacement here. So is there possibility that we need to create opportunities for people to move out of neighborhoods that have been historically redlined. This kind of reminds me of some of the opportunity work, and how do we ensure that as there's investment in communities, it doesn't, that we're not looking at displacement kind of as an issue, understanding displacement as an issue. How do we focus perhaps instead at looking at creating opportunities for folks to move out of historically redlined communities to communities where there's more opportunity? And I know there's a lot of thoughts, I'm sure, on those fronts. So I'll leave it as an open question, and maybe I'll, Josie, take it to you first, and then Angela, turn it to you, and then Sadhana. Josie, what do you think about either one of those dimensions of an interesting phenomenon? You know, the question of the relationship between redlining and gentrification. If we undo redlining, how do we prevent against gentrification or the negative aspects of that?
I think from experience and just from a professional experience, what I've seen that we do, we actually partner with developers who are willing to be open to different strategies to create affordable housing. The owner that took over the apartment complex that I mentioned that now is rehab, those 177 units, when we began to build an advocacy campaign to get that out of the hands of the slumlord, honestly, that it was in, a part of that campaign was being very honest with who we wanted to be at the table. And so when we sent out actually notifications in a newspaper, it was basically saying developer wanted. It was front page news. A developer wanted, but what was so interesting, it was like to work with community. And so to create these changes, and we put these very stark pictures on the front page. This apartment complex had an apartment that sewage had been in an apartment for 3 weeks, and a family with 3 kids were living like that for 3 weeks. And this is not a subsidized unit. This is a privately owned unit. So how does that happen? And so we began to look at all that, and then, you know, we had these last straws, like we're fed up, and we got buy-in from the community to really advocate for change. When we put that out there, we had developers come unknowing that we were going to get that response from not just in North Carolina, but outside of North Carolina. I would have never thought that we would have got that response. And so they recognized what we wanted.
Mm-hmm.
So for them to come to the table and be willing to be open to sit with community, hear different strategies, that got the city's attention. And so the city, through housing bonds, were able to divert funding to our efforts. And so they helped with the rehab of that by giving money to make those units energy efficient. We had some social impact investors that came along, which I didn't even know that existed. Who knew that there were investors that actually want to give money to causes like this? And the other thing I would say, as far as safeguarding against displacement, and this correlation between redlining neighborhoods and gentrification, I can see that it is inevitable for that to happen, because whenever there is, like you saw in that video, you have to ask, that is literally at the crescent of this neighborhood, right? And so obviously that is a sign of gentrification. You don't put $1 million homes right at the crescent of a neighborhood. Well, I just showed you all these boarded up homes and things of that nature. And so the work that we want to be a part of is opening up real honest conversations with community leading that, because if the community gets the buy-in and begin to speak up, that's honestly where the change can come from. And so I would recommend anyone to take that community voice seriously, because they have the power to open up discussions in a way to stop it. Cottage Grove have those similar characteristics, but when we begin to advocate, the process that we saw happening where the signs of gentrification was coming was halted, because now it's like there's so much light on Cottage Grove that you can't ignore it. And so there's so much support around it. You could just tell things just stopped, that we're heading in the direction.
I have just one thing I want to, Angela, I want people who are concerned about gentrification to go to PolicyLink, look under housing and the anti-displacement network. There are a ton of strategies that you can find there. But the main thing is, as the development process is moving forward, bake in affordability. It is so much easier to bake in affordability at the beginning of trying to transform a neighborhood than trying to create affordability after it's always a destination. The main thing to do in terms of people moving to opportunity neighborhoods is to make sure that we have aggressive inclusionary zoning. Much inclusionary zoning only goes down to 80% of the the median for housing in the median income, we need to get down to 30%. And we need to be aggressive about making sure that there's inclusionary zoning in places where we already have opportunity. But I really want to encourage people about the gentrification question to go to the PolicyLink website. We've been putting up ideas for that for the past 10 years.
And I will
Angela.
add that, Rishi, that speaking to what Angela was saying, that developer inside the portfolio, the financial portfolio, for her to take ownership of it, because of the type of portfolio it was and the people she was working with, there was a rent cap on that housing complex. So that speaks to what Angela was saying, is baking that in on the front end. And so you can't go above a certain rent, no matter what's going on in that area.
Josie, Angela, Sadhana, this is the beginning of an incredible conversation, and today certainly kind of raised the bar. I know it's not the last of our conversations, and I think that for all of us who joined, I want to applaud and thank you as presenters, and thank you for all of you who've tuned in. Please do stay engaged with us, as this wonderful emoji indicates. Stay engaged with us, not just with us at Health Begins, but with the resources and the expertise that both Angela and Josie, as well as Sadhana, brought to the table. Use the hashtag #redlining as you're conversing in social media or emailing with people about it, so that we can have this conversation under a broad umbrella, and then share your stories with us about successes as well as setbacks and some of these issues as well that came up in the latter part of the call. This is the beginning of a series of conversations so that we can think about how we can collectively take action to undo redlining. It's part of our commitment at Health Begins to make sure that we continue asking the right questions, and hopefully together we'll come up with the right answers. And more importantly, transform this into action. You'll see a follow-up survey come shortly. Please share your insights and your ideas. Again, take action in all the ways and with all the resources that our presenters have shared today. And thank you. Thank you, Angela. Thank you, Josie. Thank you, Sadhana. With deep appreciation to all of you. We'll see you in the next webinar, and we'll stay in touch in many other ways. We'll see you on the journey upstream. Thanks, guys.
Thank you.
Thank you.